Hi everyone and welcome to my set of blog posts about hormones. So I'm starting today with an introduction about hormones, specifically steroid hormones, because I want to build up and eventually speak about the link between using hormone therapies like contraceptives or hormone replacement therapy for women undergoing menopause, and the link of this use of hormones to that of breast cancer risk. So it's quite a difficult topic to discuss, and I'd like to just start by building up the basics, which is what I'm going to do today. So when I'm talking about hormones, I'm referring to sex hormones or steroid hormones. These are hormones that you would know perhaps like estrogen, progesterone, testosterone, as well as stress hormones like cortisol. So I wanted to speak about today, where are these hormones produced, how are they produced, and what is their role in the body. So starting off with where these hormones are produced, they are made in various tissues. They are made in the kidneys, they are produced in your skin and in your fat tissue. In men, they are made in the testes and also in the ovaries and the breast tissue in women. So different tissues are going to make different levels of hormones depending on what they need. For example, the testes are going to make more testosterone than the ovaries. Okay, so the next part is how are these hormones made? I'm using the example of the stress hormone cortisol because it is the easiest one to explain. And the same principle follows for all other hormones, but we've also all experienced stress. So what happens, for example, you are standing in the middle of the woods and you see a bear, or if you meet a spider, and you absolutely lose your mind and freak out. And how does this happen? Your brain is responding to this stress by activating the hypothalamus, which is a part of your brain that regulates hormone production. The hypothalamus then creates a signaling molecule that then activates the pituitary gland, which then makes another signaling hormone to activate the kidneys, and the kidneys then produce cortisol, which is your stress hormone. So you can see that the processes in the body are not just, you don't just go from point A to point B. You go to point A from point to point B, but there's about 10 steps in between. So this is how your body regulates processes. And essentially what happens then is you make enough cortisol, you have your freak out, you run away from the bear or the spider, and you eventually need to calm down. So at that point where you need to calm down, your body recognizes that there is no bear. I don't need to be running no more. My brain can really stop sending me these signals. I've made enough cortisol. I've done what I needed to do. And at this point, your kidneys then signal back to your hypothalamus and your pituitary gland and tell it, listen, we're done. I no longer need to make these hormones, so please stop telling me what to do. And essentially, that is how your brain leads to the production of all other steroid hormones. And it applies the same whether you're looking at the kidneys or the ovaries or the breast. So the next step is the what. So what do these hormones do? And I first want to start off with looking at how these hormones are made. And what is really interesting about sex hormones is that they are actually all produced from cholesterol. And yes, I did say cholesterol. And no, I'm not talking about the cholesterol that you get from eating, 7 like Big Macs at once. I'm speaking about the normal cholesterol that your body needs, the healthy cholesterol, so-called high-density fats, that your body actually needs for various processes, one of which is the production of steroid hormones. And most of the cholesterol in your body is used for these purposes. So cholesterol first leads to the production of progesterone, which, as you can see, is kind of this next stepping stone for the production of all other steroids, right? So I want you to think of your body, specifically this process, as kind of a road where there's a bunch of cars going everywhere. And if you have a lot of traffic in this progesterone area, the cars need to move somewhere else. They need to go down other roads or avenues. So increases in progesterone will lead to the production of other hormones because these cars or these hormones need to move around. They can't just stay stagnant. And this is what we would refer to as metabolism. So we all know that saying someone has a fast metabolism or a slow metabolism when you speak about food, but food isn't the only thing broken down in your body. Hormones are also metabolized. So an example of how you would use this word is cholesterol is metabolized to progesterone, and progesterone is metabolized to produce testosterone. Okay? So starting off with the role of progesterone, for a really long time, scientists never really focused on progesterone because they thought, look, it's just the stepping stone for the other hormones. But it is actually really important in the maintenance of pregnancy in women. It also has other roles in the breast and the ovaries, but we'll get to that at a later video. Progesterone also leads to the production of this hormone called aldosterone, which you probably haven't heard of, and don't worry. It's not, most people don't know about it, but this hormone actually leads to the production of, or leads to changes in salt and body fluid regulation. And this links back to the use of the contraceptive pill. So most women who use the pill complain that after using the pill, they've gained a bit of weight, right? And essentially what the pill is a drug that kind of looks like progesterone and does what progesterone is meant to do. So your body doesn't really know the difference between that pill and progesterone. So essentially what happens is when you're taking the pill, it changes the levels of all these other hormones. And one of the big side effects is that women gain weight in those initial months. And it's because you are actually changing your body fluid regulation, and you essentially are gaining water, not actual fat mass, although that does happen in some women as well. Progesterone also leads to the production of cortisol, your stress hormone. But this is not just a stress hormone. It's really important for inflammation in the body. So if you are punched on your arm and you get a big bruise, it causes a bit of inflammation in that area. It's also really important for the regulation of your immune system, as well as water retention. This is again one of the side effects of the contraceptive pill. You're taking in progesterone over here, leading to the production of cortisol. And women on the pill often exhibit a weakened immune system. So you'll perhaps notice that after being on the pill, you are more sensitive to getting the flu, which you weren't before. And that is really a normal part, or a side effect of getting the pill that's quite common, of being on the pill that's common. Progesterone also leads to the production of testosterone, which we know is super important for sexual development in men. It's really important for your mood and your libido in both sexes as well. And testosterone then leads to the production of estrogen, which is important for sexual development in women, specifically breast growth, and is probably the most well-known female hormone because of its association with breast cancer. Another part of female development where estrogen becomes important is in postmenopausal or in menopausal women. So essentially what menopause is a really big decrease of estrogen in your body. During menopause, women really make little to no estrogen in the body. And what happens then is women have increased testosterone, right? So no, your testosterone is not being converted to estrogen anymore, which means that you get a buildup of male, so-called male hormones such as testosterone. And this can lead to symptoms like mood swings or aggression. So this is really frustrating for most women undergoing menopause. And so what they do is they consult a doctor who generally prescribes hormone replacement therapy, which is usually just an estrogen patch to try and supplement the estrogen in your body to bring it back up to normal levels, so you no longer have that side effect of menopause. However, what happens now is you're adding in estrogen into your body, which your brain thinks your body is producing, right? So you're taking a pill which looks like and does what estrogen does in your body, so your body gets kind of confused. And what happens then is it thinks that your kidneys are making a bunch of estrogen, so your kidneys or your ovaries and all those different tissues signal back to your brain and tell it, listen, we have made enough, so you can stop now. And what happens then is your brain makes less of these hormones that lead to the production of estrogen, and you get a decrease in testosterone. And that decrease in testosterone is a possible reason why women using menopausal hormone therapy complain of depressive-like symptoms or decreased libido. Okay, so this is really the introduction to steroid hormones. And please watch the future videos if you're interested in investigating with me how these hormones are affected by contraceptives and by hormone replacement therapy, and what are the links of those treatments to breast cancer. Please also, if you have any comments or questions, please post it on the comment section in the YouTube video, or on the Facebook page, or on the blog, or email me. The link is on my blog, and my email address is on my blog as well. Thanks.